I recently saw a young woman, 29 years old, with cauda equina syndrome. She was sent to me for follow-up. She had had surgery already. What is this? Cauda equina syndrome. Usually it's from a herniated disc that's acute or sudden. It's usually a very large herniation that compresses all the nerves in the low back. Now remember from your anatomy, your spinal cord ends at the top of the lumbar, at lumbar 1, and the nerves hang down. Those nerves are called the cauda equina. If they get compressed severely, patients will complain of symptoms of numbness in the groin, what we call saddle anesthesia, numbness throughout your groin region, urinary difficulties, you can't urinate, you might lose control of your bowel or bladder, and so forth. The problem with this is they need immediate surgery, and the sooner they have surgery, the better chance of recovery. If they have delayed surgery, like the patient that was sent to me, she has permanent loss of bowel, bladder, she has no sensation in her groin area, and she'll have to catheterize herself most likely for the rest of her life. So it's a very bad thing. It takes 2 years really for full nerve healing, so it's a wait and see game, but it's a really tough problem, and it's a disaster for the patients if they're not treated by someone savvy enough in the emergency room to get them right away to the neurosurgeon to get the nerves decompressed. So it's a scary condition. It does happen. It's very rare, but hopefully the patients recover from that.